All right. Good evening, everybody. Welcome to our talk show today in celebration of the World Diabetes Day 2024. Today, I have with me two guests that are going to be helping us unlock the topic of well-being in staying healthy, preventing diseases, and especially managing diabetes. Um, uh, my name is Joseph. I'm the founder and CEO of Platos Health. And today, what we've planned for you is to go through a couple of questions about or topics about diabetes, high blood sugar, and insulin resistance. We're going to talk about lifestyle and well-being, and how this connects to diabetes and insulin resistance. And we really hope that we can give you some practical tips on how to apply this thing in your daily lives, and especially actions that you can take to influence your overall well-being. We're going to dwell on physical and mental well-being. We're going to touch other aspects of well-being as well. And through the YouTube live comment, feel free to drop some questions or topics that you hope that we can cover today. And then at the end of the towards the end of the session, we're going to take some questions based on the relevance to the topic here. So that's it. We look forward to a productive and useful session. So one after the other, I'm going to invite our speakers into the live show. First, I'm going to add Dr. Funmi, and then I'm going to add our second speaker, Dr. Ijeoma Dozie, to the stage as well. And now we can actually start with a short introduction so that we can get to know our speakers. Dr. Funmi, over to you. Please tell us very quickly, or take your time. Who are you, and so that our audience can get to know you.
I'm a consultant physician and endocrinologist, a fellow of West Africa College of Physicians, lead endocrinologist with Platos Health. I have several publications on diabetes, which is my passion. What actually attracted me to Platos Health was when Joseph talked to me about Platos Health, that they are going to include lifestyle, and are going to have something to monitor and track our patient progress. And that has always been my passion, because in the physical clinic, we don't really have opportunity to see patients, track their markers, and be able to follow them, their day-to-day activity. So I keyed in, and I can say it was a success story.
Thank you very much, Dr. Funmi. And now, Dr. Dozie, I just gave you the stage now. So,
okay.
Yeah.
Thank you, Joseph. Good to be here. My name is Dr. Ijeoma Dozie. I am a consultant family physician, and I am a board-certified lifestyle medicine physician. Very passionate about lifestyle medicine and how it can affect chronic diseases. And we're starting to see a lot of data on remission of chronic diseases using lifestyle medicine. I'm a member of the Society of Lifestyle Medicine of Nigeria, the Publicity Secretary to be specific, and I work at the Federal Teaching Hospital in Owerri, Imo State. So I do a lot of work, research, advocacy regarding lifestyle medicine and primary care, and how we can ensure, with a vision, because the vision of SOLONg essentially is to ensure that Nigerians lead healthy lives, and that's kind of what we do at SOLONg, and also at all the other places I'm affiliated with. So it's really exciting to be here today to talk about diabetes on World Diabetes Day. Thank you for having us, for having me.
Thank you, Dr. Dozie, for that introduction. Just to kind of help all of us understand the audience here today. So today we have people that are living with diabetes. We also have people who are not living with diabetes, but are curious on the about the subject of insulin resistance. And so throughout today, we're going to be talking about, blood sugar, diabetes. We might also be talking a little bit about insulin resistance. And I think a lot of people are actually curious about what is insulin resistance and how does this have, what does this have to do with living healthy and having a better having better metabolism. And I just want to kind of set that context for many of us that the audience is actually broader than people living with diabetes. And the question that I would like to start with, and maybe I'm gonna is to ask Dr. Funmi to help us understand what is diabetes, or what is high blood sugar, and what is going on in the body when blood sugar rises. And if you can also help us sort of shed light on the topic of insulin resistance as well, that would be great.
Diabetes can be defined as a chronic disease which is characterized by high blood sugar. I will use high blood sugar because I'm talking to non-medics. We say glucose in medicine. And what is responsible for this is when you said that as a result of body not secreting enough insulin, or the insulin is there, but it's not acting the way it should act. What do I mean by normally when you eat? Every food you eat is converted to sugar. And there's an organ in the body called pancreas that secretes insulin. And the function of this insulin is to take everything you've eaten to where the body can make use of it. That is, the body will convert whatever you've eaten into sugar, then the insulin will take it to where the body will make use of it. The same thing when you have money, you go to the market, you buy things, and you make use of those things. But what happens in diabetes is this. The pancreas is not producing enough insulin, or the pancreas is producing insulin, but the insulin is not acting. When the pancreas is not producing enough insulin, we call that one type 1, although in the later stage of type 2 diabetes, we can also have that one. But in the early stage of diabetes, of type 2 diabetes, I'm talking about majorly on type 2 today. We have two major classes of diabetes, type 1 and type 2, and there are others classification. But the commonest one is type 2. Over 90% of diabetes cases are type 2, and less than 10% are type 1, and we have other types. In type 2, what happens is that the body is secreting insulin. You have adequate insulin. But this insulin needs to act on a receptor. So I can liken it to a door with a lock, and you have a key. When you have a key, you are expected to use the key to open the door. When you open the door, you gain access into the house. But what happened in type 2 is this. You have the key. You have the door with the lock. But the key is faulty. It's either the teeth is broken, the teeth are broken, or one of the teeth is cracked. So if you use that key on the lock, definitely you cannot open the door. And if you cannot open the door, definitely the sugar cannot get to where it's supposed to act. And that is what's happened with insulin resistance. You have enough insulin, but the insulin is not doing its function. So that means you have excess of this sugar, but it's not getting to where the body can make use of it. The body needs this sugar to act as fuel. When you want to run your car, you need fuel before your car can run. You want to run your generator, you need fuel. Before your body can function, you need fuel. So this glucose is a fuel. It needs to get to where the body will make use of it. So that's what is happening in type 2 diabetes. So you have the key, you cannot open the door. So you have this sugar in excess in the blood. It's not getting to the liver cells where the body can make use of it. It's not getting to your muscle cells where the body can make use of it. And it's not getting to the fat cells where the body can make use of it. And that is why I can liken it to say you have excess, but you are still suffering. You have money in your account, you don't have access to it. It's either you don't have your checkbook, you cannot sign, or you are sick, you can't go out to go to the bank. So you have the money there in the bank, but it cannot work for you. So the same thing is happening in diabetes. You have the blood sugar resting in the blood, but where the body needs to make use of it, it cannot get there. And that is why, because the body is starving, they will present with what we call hunger pan. That's why we say people with diabetes, they will present with what we call polyphagia. They are always hungry amidst excess. They have excess sugar, but they are still suffering. So what now happened to this blood sugar in the blood? They are accumulated in the blood for a very long time. Definitely they have to look for a way. So what do? They get deposited in various organs in the body.
Right.
They can get deposited in the eyes. They can cause complication in the eyes, vision loss.
Yeah, just Dr. Funmi, just a second. I'm sorry to cut you short there. I think you're actually linking to an interesting subject, which is what I wanted to, as a follow-up question to your great analogy or great analogies on how we can understand the concept of diabetes and insulin resistance. I actually wanted to follow up with a question about the manifestation in day-to-day life, right? I think that you were now gradually starting to touch on the symptoms and how this manifests in day-to-day life. You spoke about the hunger that people have and the cravings. Could you, what other symptoms do people see or experience when this starts to happen?
So what happened is this, like I said earlier, they have excess sugar, but it's not getting to the body. So they are starving amidst excess. So they can present with hunger pant. They eat excessively. They keep eating. The sugar keeps accumulating. Because they have this excess sugar in the body, what sugar does is that, because it's a science, there's something we call osmosis, for those that understand science, where you have high concentration of either salt, sugar. What will happen is that the body will we have to pull water to dissolve it. So by pulling water from the body, so they will start urinating excessively. So they present with excessive urination, increase in the volume of urine. But because this sugar is attracting water, absorbing water from the body will be starved of water. So they will be dehydrated. They will lose weight. So I've talked about hunger pants, dehydration, that is weight loss, and excessive urine. So I will stop at that when I come to complications, so that I won't go beyond what Joseph has asked me. Another thing I want to say is this. Some of them will not even present with this complication, with these early symptoms. They will rather present with complication. We will come to that later.
Thank you very much. Thank you very much for that. Because of time, I'm going to switch on to the next question. So I think we'll look at the daily manifestations of that. You've talked about some symptoms. I think you gave us two really good symptoms, which is about, the osmosis and how that leads to frequent urination and dehydration. Now, I want to maybe kind of switch to the topic of lifestyle and well-being, and particularly point this towards Dr. Dozie. So diabetes and other chronic conditions, we can trace that to modifiable risk factors. So things like genetics, family history, and non-modifiable risk factors, right? And I would like to hear from Dr. Dozie, how do we how do we connect? What are these modifiable risk factors that we speak about here? And if you could help us with understanding some of those key dimensions and perhaps what are the relationship between these factors and insulin resistance. I think Dr. Funmi, started to talk about some things when you spoke about food. And I think, that would be really great for our audience to understand what are these risk factors, these non-modifiable or modifiable risk factors, and what are they, and how do they really, how do they relate to diabetes and insulin resistance?
Okay, thank you very much, Joseph. Good to be here once again. So like you've asked, there modifiable and non-modifiable risk factors. So the fact that your race, your ethnicity, your age, those kinds of things, your genetics, those are non-modifiable. There's not much you can do about those, right? But the modifiable ones are the ones we're here to talk about, and they play a significant role in your ability to your risk factor for diabetes and how to manage it when you have it, and then the progression to complications, that kind of thing. And we have things like physical activity, the diet, stuff about diet, of lifestyle, presence of obesity, and cholesterol, smoking, stress, high blood pressure. Are some of the parameters that I'm aware that Platos Health tries to track using their app and all of that. So we also know, I'm a lifestyle medicine physician, and we approach this from the angle of lifestyle medicine. There are 6 pillars: diet, where we promote whole food plant-based diets. And studies have shown that those whole food plant-based diets, especially low-calorie diets rich in fiber and all of that, can improve insulin sensitivity in people that are trying to link it to the insulin insensitivity question that was asked earlier. So can help to improve sensitivity of insulin and in fact enhance diabetes remission, which is a new thing that we're going into. And even Platos Health has a published study on that. They'll talk about that as we go along. Physical activity also improves insulin sensitivity, because the more you contract those skeletal muscles, the more likely it is for them to take up the insulin, the glucose that is being circulated in the system. So you're helping it, you're reducing the workload on the pancreas. And physical activity is another pillar of lifestyle medicine. Stress management, of course, this presence of stress, increases the cortisol level, puts you in the parasympathetic state and all of that. And you don't want that happening because, it's not good for the sensitivity and it predisposes to diabetes. So stress management techniques are very useful for people, and that's one of the things we advocate for in lifestyle medicine. Common things like breathing exercises, like there's a 4-7-8 technique and all of those things, mindfulness, even having a good night's sleep, restorative sleep, which is a pillar of lifestyle medicine, is also very significant in the pathophysiology of diabetes. Why is that? If you do not sleep, studies have shown that people that sleep less than 6 hours in the night are, at increased risk of diabetes, overweight, even hypertension, if they sustain this for a long time. Now, why is this the case? If for somebody that doesn't sleep properly, and this is very important because, there are lots of stressors in our environment and all of that. But if you don't sleep enough, and the sleep, now restorative sleep is quality and quantity of sleep. So now if you don't get the restorative sleep that you're supposed to get, you have your appetite hormones called your ghrelin and the satiety hormones, your leptin. So there's an imbalance. So ghrelin that should stimulate hunger, it starts working over time. So you find out that you're excessively hungry and you actually crave simple carbohydrates. Now your leptin that should trigger satiety, tell you when you're full, is reduced, and so you don't know when you're full, so you end up overeating. And you can see how these two things are not good for obesity, which is one of the non-modifiable risk factors, and ultimately not good for insulin sensitivity and ultimately diabetes. I'm still going down the pillars of lifestyle medicine, and then going down to of course the risky substances. Tobacco, we want you to stop that. Alcohol, limit that. If you don't drink, don't start drinking. If you drink, do 1 unit per alcohol for women, 2 units for men, that kind of thing. And finally, positive social connections. So those ones also kind of intertwined with stress, with purpose, with well-being. And Joseph had talked about well-being and the dimensions of wellness. And so we can also link that to positive social connections, because we want to be well, we want to live well, we want our interactions, our relationships to be positive relationships that bring about positive hormones, joy, gratitude, and things like that, being able to forgive and have a purpose in life, and we know that the dimensions of wellness cut across the physical, cut across the occupational. Are you happy in your job? Are you intellectually sound? Like we usually say, elderly people, and a lot of the type 2 diabetes we see in the elderly. And so we say elderly people need to start learning new skills, new mental skills. I remember my mother-in-law visited and I taught her to play Scrabble and she was so excited. She's past 80 and she learned Scrabble for the first time. And that's fantastic for elderly people. So it's a kind of well-being. We're talking about diabetes and well-being here, and that's why I'm bringing that up. So intellectual wellness, using your brain, your social interactions, spirituality, does that help you positively or negatively? Because there are some negative effects of spirituality, but here we're talking about the community feeling of it and how it helps you. And there's studies showing that people that believe in God, people that pray, to have better outcomes after surgery. So there are studies like that. And there's even a spiritual center affiliated with Harvard where a lot of these studies are being done. So that is something that we shouldn't also throw away. And of course, the economics of it all, how are you managing your money and all of that, that has a role to play. And we know that diabetes management is very expensive. So we want people now to start going back home. What foods are affordable that are still healthy without breaking the bank, and some of these other things, how do we do them on a budget? And I think we'll talk more about that as we go along. And of course, lastly, our environment. We're now advocating for things like gardening and all of that. If you have a compound, you have bags, you have space, plant some of your veggies that they are easily accessible to you and all of that. So I'll stop here as we go along.
Thank you very much, Dr. Dozie, for the comprehensive overview of lifestyle, the modifiable risk factors of diabetes and other chronic conditions. I think that she's most likely not in the call anymore. Probably that's something about the network. So I hope our technical team can check in with her and make sure that we can get her back into the call. I was going to actually ask a follow-up question there. I think she's back now. Yes, welcome back, Dr. Dozie. I think we lost you for a second there. I was going to ask a follow-up question there regarding the different dimensions of the modifiable risk factors that we're speaking about here. And actually, any of you can answer. We know that there's a rise in prevalence, for example, on the African continent. I think Africa has the least prevalence of chronic conditions in general across the entire world, not in terms of total size, but prevalence relative to the population. And I know that so countries like the United States, they have bigger problems on obesity and diabetes in Northern Africa, for example, also Europe, China, Brazil, different areas of the world. But it's rising very fast in Nigeria and in Africa. What we see is that from the stats, today there are about 30 million people living with diabetes and insulin and glucose intolerance, right? And that's expected to be roughly 150 million by 2045. What has changed? What is changing, and why is this on the rise so much? What has changed in the food that people eat, in the way of living? Why is this such a big problem today?
Okay, can I take that, Dr. Funmi?
Yeah,
Or do you
go
want
ahead.
to go ahead? Okay, great. Our diet has changed. So before now, the older people used to pluck directly from the farm. You go to the garden, while you're there, you pluck. We used to eat a lot of game. The hunters would go and farm, get those animals, and so they were lean. It was lean meat they were eating when they had the meat, and it was mostly veggies or things directly from the farm. But now we're doing a lot of packet foods, a lot of processed foods, and we're doing a lot of non-lean meats. I mean, that's why open grazing or free range products are now supposed to be expensive. Ideally, that was the ideal before, and then that's for our diet. Now, for our physical activity, we are sedentary. I mean, we've been sitting down having this webinar, live podcast, and we're all seated. And we probably were at work for many hours, and we were seated in the office. Most of us work in places where our tables are not designed to get up and stand up and all of that, and we should be evolving into things like that. There are tables that have attached treadmills to them so that you can actually be working out on your limbs as you're doing your day-to-day tasks. But a lot of our workplaces are not fitted to do that. So that has changed. And now, because of the long hours we work, the mothers are working, the daddies are working, we're not getting enough sleep. So you're combining the work with the household chores and all of that, raising the family, the kids. We are not sleeping enough. That's already 3 things. And if you add all of this together, of course, your stress level goes up as well. And then because of the way we live, for instance, you live in somewhere like Lagos, you live in a GRA, and you don't know your neighbors, so there's no social connections. You can't relate with anybody. So I was talking the other day and saying somebody will die, and 3 days later your corpse is still there. Nobody has noticed that you haven't stepped out of the room or you haven't come to work and all of that. And that is really horrible. So no social connection. So all those pillars, and then people now distress using alcohol and tobacco. So just that combination is what has completely changed in the African environment.
Wow, that is powerful. That's incredible that people, I'm kind of tempted to get off my feet right now and get on my legs and begin to stretch. And thankfully, I'm the kind of person that is at least aware of that, and I try to get as many steps as possible in a day. We're going to get to that in a second or very soon, where we're going to discuss some practical things that we can all do. Since we have 2 medical doctors here, so they feel free to prescribe, to make recommendations on each of these dimensions of lifestyle that we're talking about here. Dr. Funmi, is there something that you would like to point out on top of what Dr. Dozie just shared about
Nothing really. I just remember growing up, you have trees to climb, you run on the roads, but these days they'll stay indoor. Even your children, they sit down in front of the television from morning to evening, taking chocolate, ice cream, all sorts. In those days, we don't. If you take ice cream in a year, is maybe during Christmas. But now is incorporated into everyday meal. So I think Dr. Dozie has said everything.
Great. Okay, that's super interesting. I'm super curious about many topics like the lack of social connections, for example. Most people know Africa, Nigeria as a high touch culture, where we connect a lot. We have a high value for community. I think our ancestors ate food on around the same pot, and so I'm personally curious to see what's going on in Nigeria and other parts of Africa that is driving this trends that you've spoken about, especially the part where people pass away and they don't nobody kind of finds out after 3 or 4 days. Unfortunately, we don't have enough time to cover all the topics here today. So I'm going to move on to, so what I want us to kind of spend the next 25 minutes that we have on is really about the relationship between the lifestyle, right, and well-being, and the evolution of these conditions. And I think a very simple example that I can give here is when I think about a person's well-being, right, can influence their lifestyle choices, right? If or if somebody is living with, say, diabetes, for example, or you have whatever kind of other condition, obviously it puts a bit of limit on your well-being, on the things that you can maybe directly influence. And then, for example, somebody that is experiencing a high stress situation, right, which I believe is a well-being factor, um, you might neglect healthy eating exercise, right? Sorry, healthy eating or exercise habit, which is a lifestyle factor. Anyway, however we want to sequence it, like I believe lifestyle factors are things that you can act on, and then that has a huge influence on your well-being. But then if I add a condition like living with diabetes into that loop, then it becomes like a loop. And I think the the question, what I would want our audience to take away out of this is, if you put lifestyle and well-being on one hand, and then you point an arrow to either you to a condition such as diabetes, and you want to affect that, you want to change the loop, right? You want your well-being you want an improvement in the well-being, either on a physical level, on the mental level, if it's about the social aspect of it, and so, and then on the other hand, you want an improvement in the outcomes, like uh, your glucose response, for example. You want to reduce weight, so that you can lower the risk of chronic conditions such as, say, diabetes, for example, because we know that overweight, and you've already explained the relationship between the hormone insulin, and how that can cause overweight, how that leads to cravings, right? And then the more you eat, your body is not able to tell you precisely when you need to stop, and that leads to overweight. And I think this loop is not only for people living with diabetes, right? It's also just a regular loop for us on a regular day, how our lifestyle is basically structured. So I want to talk about practical tips on how we can modify this loop, right? And I know from the work that we've done with with Dr. Funmi and some of the other physicians in Nigeria, or anybody that works in managing diabetes or probably other metabolic conditions, you always talk about five we call markers, or primary markers, that we should all keep an eye on. And so what are these primary markers, and if you can help us understand why is this important for managing diabetes, but also actually for people that want to prevent. I believe that the more you can focus on your blood pressure, your glucose, your cholesterol, your weight, and your waist circumference, how is that an indication, or how is that an indication of something that we should keep an eye on in order for us to measure the in order to measure the progression of these conditions?
Okay, so I guess you were asking Dr. Funmi, but it's fine.
Please go ahead. Yes.
I'll approach it this way. Okay. And you want practical things. So these things are measurable. Of course, you can monitor them. We talk about annual screening. You can also decide every time you go for a clinic visit, these parameters can be tracked. But now linking it to lifestyle, let me start with diet and just give a practical example. So normally in the clinic, when I see patients, I use my healthy plate. I'm currently running, like I had training yesterday, and we're currently training staff in the hospital on how to prevent sudden collapse and sudden death. And one of the parameters we're using are the pillars of lifestyle medicine. So for diet, we have my healthy plate. And generally, in layman's term, we say 50% of everything that appears on your plate should be vegetables. Whether you're diabetic, you're hypertensive, you want to lose weight, or you're just a normal person that wants to live a healthy life, 50% of anything on your plate should be vegetables. And now you don't have to start waiting for the broccolis of this world and all of that. They are expensive and usually above the reach of everybody, and most people in Nigeria. So coming down to Nigeria, domesticating lifestyle medicine now, we have our ugu, we have our pumpkin leaves, our afang, ewedu. our dark green leafy vegetables are very rich in fiber, and you can use them. You can use the cabbage, the carrot, the cucumbers, the tomatoes, and all of that. There are lots. Africa is rich in vegetables, but we need to remember that we need to start appreciating what we have locally. So that's 50% of the plate. Now, the remaining 50% of the plate, you split it in two. Half of that should be your starch, your wholesome starches, and the remaining half should be your proteins, preferably plant-based proteins. Now, what are your wholesome starches? We're talking about complex carbohydrates that are rich in fiber and that are unprocessed. So for other countries outside the world, they talk about whole grains. In the northern part of the country, yes, we'll be talking about whole grains. But I'm in the southeast, and most southerners, we do a lot of tubers. So we're talking about your yams, your sweet potatoes, your cocoa yams, and all of that. We're also going a step further to talk about your fermented carbohydrates, which are also very rich in probiotics, and we see that probiotics are good for gut microbiomes and very good for diabetics. So things like your gari, your akpu, your amala, which is from yam, your ogi, and all of that. And we're saying, do not refine these things. When you're making your ogi, you don't need to sieve out that chaff because you're taking out the fiber. When you're making your moi moi, you do not need to remove the back because you're taking away the fiber. So take it as it is, as it has been, as wholesome as it is, and still prepare the way with ordinary, minimize sieving, minimize processing, and just get it like that. So that's for our wholesome starches rich in fiber. And fiber, especially soluble fiber, is very good for diabetics. And then, of course, your protein, you have things like your beans. We say, even though beans is partly carbs and partly protein, but the protein in beans is amazing for, a wholesome diet. And then minimum, more of the white meats, like your fishes, your poultry, and less of the red meat, like your beef and goat meat and all of that. So just, minimize those as much as possible. So that's one practical example for diet.
I have a follow-up question there, actually. Thank you very much for the comprehensive overview again. I'm curious about I know our food in Nigeria is very, if I look at how a typical person eats, you would have the pounded yam or the amala. You have that on the plate, and then you have the vegetables. Actually, the pounded yam itself is also a vegetable, right? And the language that we like to use is the non-starchy vegetables and starchy vegetables. So non-starchy vegetables would be the ugu, and then the starchy ones would be the yam and all of that. And then you have the protein part. You described really, really well. And then I think I was curious about the probiotics part that you mentioned, because many people think that you shouldn't eat gari, for example, or eba and all of that. And you started talking about probiotics. Can you help us understand? Can you help us clarify what you mean here on that? I'm not sure I captured that part very well. Yes.
Yeah, that's fine. So we're evolving into fermented foods. Now we are seriously advocating for fermented foods, and we're also trying to link the gut microbiomes with how well they help in reducing the prevalence or the severity or even the risk of having diabetes. So there are studies on that. I'm even currently working on something in that line, linking it with even antimicrobial resistance and intensive therapeutic lifestyle change. So there is a link. So now, one of the major things that help the gut microbiomes are foods that are rich in probiotics. And the common foods that are rich in probiotics that we knew before were fermented dairy, like your cheese and your yogurt. But we're now seeing that it's not just the cheese and the yogurt that have these. Even our locally fermented foods also offer these benefits. And so since the cheeses and the Greek yogurts may be are expensive, because we're talking about economics, remember, is one of the dimensions of wellness. So let people also understand that the gari is fermented. The amala is fermented. We have seeds and nuts that are fermented. Like in Igbo, there's the breadfruit, which is ukwa, and then the uba, they are fermented. Then we have the ogi, the agidi. Those ones are from corn. So you have things that are fermented from grains and things that are fermented from the starchy vegetables that you talked about. But where the caveat here is that don't go to town, don't overeat. The portion size, portion control is absolutely important. So you don't say, oh, she said gari is amazing, I'm going to sit down and eat a pot full of gari. Please, I did not say that. So it's still your same feast size that we have always said is the recommended amount of those starches, the starchy vegetables that you should be having. So I think I just needed to emphasize that.
Thank you. Thanks for the clarification there. Dr. Funmi, before you dropped out of the call, and I want to talk about physical activity and movement afterwards. I was asking about the primary markers for diabetes, and why is maybe blood pressure, maybe because of time, why is monitoring blood pressure important? Why is glucose measurement either through A1C or fasting blood sugar? Why is that important? Why is cholesterol important? Why is tracking weight and waist circumference? Why is that important? And what is the interplay between all of these different markers and diabetes, for example?
For that, yeah, like I used to tell my patient in the clinic that diabetes has 3 other siblings. So I call them quadruplets. Anywhere you see diabetes, you will see hypertension, you will see obesity, you will see high cholesterol level. So the 4 of them always work hand in hand. And that is why we are talking about the risk factor for developing diabetes. We talk about hypertension, you talk about high cholesterol, and you talk about obesity in terms of insulin resistance. So the major reason why we put that, these are why we put our eyes on all these markers. So when we see patients with diabetes, to first ascertain that, okay, that person has diabetes, we want to be sure we do blood glucose. Once we ascertain that, then we want to know the long-term control of this patient by doing HbA1c. By HbA1c, we mean that, okay, in the last, or even we can use it to make diagnosis and at the same time to monitor treatment. What HbA1c does is this, is the red blood cells, that is the red part of our blood cells, of our blood. We have the red blood cell, we have the white blood cells, contains hemoglobin. And the lifespan of red blood cells is about 90 to 120 days. So the sugar gets attached to the red blood cells. So by measuring the lifespan of these red cells, that is over 3 to 4 months, the glucose that has been attached to the blood cells are measured. So that we know, okay, in the last 3 to 4 months, what is the control of this patient? Because the blood glucose you do now will tell you what is the status now. But that HbA1c will tell you the long-term control. That means over the past 3-4 months, what has been the progress with this patient. And it's this long-term control that will determine the development of complications in patients with diabetes. So that is why glycated hemoglobin, HbA1c, is very important in the management of patients with diabetes. Blood pressure.
Essentially, what you're saying is that the red blood cell should be sugar-free, and during this sort of 90 to 120 days, which is the lifespan of the blood cell, you're measuring the concentration of glucose in that. And I think the question is that only because you talk about patients, right? You talk about, but not everybody is a patient.
What we're talking about
that also applies to not regular people. Not
So
that people
regular.
living like this are not regular
Like
people,
I
but
said,
yeah.
all food you eat is converted to sugar,
Right.
and it comes to the blood. Insulin takes it to where the body will make use of it. So when you have it in excess, when you measure HbA1c, it will be high. We have the recommended value. By the time it's above 6.5, according to American Diabetes Association, is diabetes. While other body will say above 7.
Okay. What about for
normal people?
What about for people who are just focusing on prevention? What is a good range for A1C, for example?
It should be less than 5.4.
Okay.
It should be less than 5.4. And we have what we call pre-diabetics.
Mm-hmm.
By the time you have it between 5.4 to 6.4 is pre-diabetes. Such an individual needs to watch it, because you are one leg into the diabetic, one leg out of diabetic. If care is not taken, like I used to tell my patient, you draw a circle, put one foot in that circle, put the other feet outside. If you adhere to lifestyle, you will take that one circle that is inside diabetes out of that circle, you become normal. But if you don't adhere to lifestyle, the lifestyle in terms of physical activity, what you eat, you will take the other leg that is outside, that is in the normal range, into the diabetes, then you fall in the circle, you become diabetic. Did that answer your question, Joseph?
Absolutely. Thank
you. Yeah. So, hypertension.
Because of time, maybe you could close on the blood pressure part, and in the follow-up conversations, I'm pretty sure we will be able to address all the other topics.
Blood pressure is also hypertension is one of the risk factors for developing diabetes. So we need to pay close attention to our blood pressure. And what are the things that can cause our BP to be lowered? Number 1, physical activity. This has been proven. Research has proven this. 2, low salt diet. In Africa, we eat too much of salt. When we cook, you see how some people, they will still put salt on the table to add to the stew. I used to tell people that when you want to eat, the salt, by the time I taste the food and I say, oh, I can feel the taste of salt. That means the salt.
Sorry for interrupting you. Look, what is the relationship between salt and blood pressure there? Like, if somebody that wants to know the why, what's going on there in the body?
There's something, in developing hypertension is defined as stroke volume times peripheral resistance. By stroke volume, we mean the amount of the fluid in the body. When the salt, and when I was trying to explain what osmosis is, I said wherever salt is, water will come in. Once water comes in, there is increase in the amount of water in the body, and this will increase the stroke volume. And since he said this is a product, definitely the blood pressure will go up. So the blood pressure will go up. And that is why when you're managing hypertension, we give something like drug that will make that person to pass excess urine, so that it will reduce the amount of fluid in the body.
Wow. Fantastic. Thank you very much for that clarification. So on the practical side of I think you were already moving in the direction of like connecting movement and physical activity with blood pressure. Maybe Dr. Dozie, what is the what do you what how much should we move? How much should we be moving on a daily basis? Either somebody is managing diabetes or somebody who wants to do focus on prevention. How much should we be moving on this on a daily basis?
Question. So thank you very much. Fantastic question. So for starters, we say do not sit continuously for more than 6 hours. So try and take breaks in between and all of that. So that let me start with being sedentary. So the chair is more dangerous than the alcohol and the cigarette. So just by the way, now to answer your question, we recommend at least baseline 150 minutes of moderate intensity exercise at least 5 times a week. What I mean is 150 minutes of moderate intensity exercises per week. You can split it up over 5 days in a week. That's what I'm trying to say. So you can split it up. Or 75 minutes of vigorous intensity exercise per week. So this is basic. Now, how do you know what is mild intensity, moderate intensity, and vigorous intensity? I'm sure that's the next question in everybody's mind. Yeah. So there's a common way you can self-pace yourself, and knowing that intensity of exercise depends on your individual fitness level. So what is vigorous for me might be mild for another person. Like Usain Bolt, what is vigorous for me might be mild for him, for instance. But anyway, let me teach everybody about the talk test. So what that means is if I'm exercising and I can sing, so that's mild intensity exercise. If I'm exercising and I can speak, that's moderate intensity, or at least I can talk and say so to get some words out. That's moderate intensity exercise. And if I'm exercising and I can neither talk nor sing, so that's vigorous intensity exercise. So sometimes, like when you're sprinting, you find out that you can't say anything, you can't sing, you can't speak. So that's vigorous. And then sometimes when you're taking your brisk walks, if you're strolling, you can sing. If you're taking a brisk walk, depending on how brisk it is, you may not be able to sing, but you can speak and say, oh, hi, what's going on, to somebody that is passing by, that kind of thing. So that's how you pace yourself. So for the moderate intensity, 150 minutes, you can split that up. So that gives you about 30 minutes a day if you're doing 5 days a week. And then vigorous intensity, less than that, about 15 minutes. And in addition, you should do strength training exercises like lifting weights and all of that. It doesn't have to be the very heavy one, so you don't rip a muscle if you're not used to it, but just simple dumbbells or pulling on elastic threads and all of that to exercise different muscles of your body also go to support, and they are very good for both especially diabetics and just people that want to live a healthy lifestyle. So we say if you must do strength training exercises every day, do not exercise the same muscle groups because it causes inflammation and it's not good for you. Other classes of exercise are your balance exercises and your flexibility exercises, which are also very good. The balanced ones are best recommended for everybody. Can do any of these exercises, but the elderly benefit the most from balanced exercises because they are the biggest danger they face is falls. And so once they learn to balance, then they can catch themselves if they are about to fall. So yes, that's what we recommend.
Right. Thank you very much. Because of time, I have a lot of follow-up questions, but I will just keep it like that. As we wrap up, I would like to try to kind of connect what we've been speaking about together. So we've spoken about making healthy lifestyle choices, like eating well. We've spoken about regular exercise. Either like instead of doing having frequent exercise at several intervals during the day is great, and so we can move. We spoke about restorative sleep. We didn't have enough time to dwell on sleep that much. That all of these, they promote good physical and mental well-being. And then on the opposite side of that, which obviously will lead to better health outcomes for all of us. On the opposite side of that, unhealthy lifestyle habits like poor nutrition or sedentary behavior, maybe substance abuse, those can have negative impact on health, and they can have detrimental effect on our well-being, right? And then there are many other topics that you spoke about that, again, we didn't have enough time to go into, um, uh, like sleep, um, um, social relationships. Something was happening with my webcam here. I hope you can still see and hear me.
Yes, we can.
Yeah.
Okay, I think I'm back now. And I'm really looking forward to a follow-up episode on our show today. Hopefully, we don't have to wait 1 year down the journey before we come back to that, before we can pick and go a little bit deeper into some of those topics. There's so many nuggets that you shot at us today. And in closing, I know that both Dr. Dozie and Dr. Funmi, you've done incredible work on things like diabetes remission, and what that means basically means that people living with high blood glucose, they manage to bring it to remission below the diabetes threshold, just leveraging lifestyle intervention. And together at Platos, in the history, we had a virtual clinic, and we've worked with many patients. And we have a case study that our team is going to drop in the YouTube channel if somebody is interested to read that. Dr. Dozie has also done some work in our own clinic on that subject. So it's a growing trend. The bottom line here is that if we can bring diabetes to remission with lifestyle intervention, how much more can we do on the preventive side by just focusing on healthy lifestyle, focusing on actions that promote positive well-being. And in closing, I'm guessing that we don't have any question from the audience, right? So, or do we have any question? Just checking the stream here. No, we don't have any questions. So, no questions. Thank you. So what I'm going to do is to Dr. Funmi, do you have any closing remark for our audience? Yeah.
I would say if you're at risk of developing diabetes, I would say get tested, keep moving, eat healthy, and maintain a positive mindset. That will help you.
All right, Dr. Dozie, what would you like to leave the audience with today?
Okay, so I'll just like to say that the 6 pillars of lifestyle medicine are interconnected, and making full use of them. There's a common mnemonic which we call DREAMS, where D is diet, and we say whole food plant-based diet. R is relationships, where we talk about positive social connections. E is exercise, where we talk about physical activity, and we've talked about that here today. A is avoidance of risky substances like alcohol, tobacco, cessation, recreational drugs, and all of that, and any other risky thing. We don't want you jumping off a building, by the way. Then M is mental and emotional wellness, including stress management. While S is sleep, which is also and the type of sleep we advocate, restorative sleep. So if we're able to live by this, ensure that all these pillars are at play in our lives, we will have our well-being will be optimum. And that is what Platos is advocating for. They want us to have optimum well-being, whether you're diabetic or not. And so that is one of the ways we can achieve that. So I want us to just take that home with us. Thank you.
Thank you very much, Dr. Dozie and Dr. Funmi. I've really enjoyed having you both on the show today. I'm like I said, I'm looking forward to having you back at some point. This is not something that we do on a regular basis, but I believe there are many subjects that I would like to dive into and go deeper. But unfortunately, we don't have the time today. So thank you very much once again for sharing your time with us. You had mentioned something about substance abuse or alcohol usage. There's actually a super interesting podcast that I personally follow called Huberman. Huberman Lab, and there's a 2.5 hours episode on alcohol and what that does to the body. If anyone is interested, we would include that in the follow-up email to this show with a link to the study that we mentioned earlier. We would also send you a link to this how or what alcohol does to the body, and so you can listen to it. Super fascinating. It has nothing to do about rules and what you should do and what you should not do. It just gives you the scientific facts about what how the body processes alcohol. Right? I think some of you are going to find it quite interesting to listen to. And we have a bunch of other resources on well-being and that we're also going to send to all of you that have attended today as a follow-up email. And feel free to shoot us questions or any topic that you'd like us to talk about in the future, any area that you're curious about. There are many different resources online. How to apply them to the context of Nigeria, which is where we're kind of the focus of our talk show today is a question mark. Dr. Dozie spoke about broccoli, and many people are not familiar with broccoli, and so how can you eat the local vegetables in Nigeria, for example, with confidence and knowing that what you're eating is actually good for your body? These are some of the areas that we are actually interested in at Platos, right? And so Platos Monitor, which is our self-management app that we have that also comes with devices depending on which condition you're managing. For example, this week we're doing a promotion campaign with several pharmacies across the country. We're working with MedPlus, with Pure Life, Alpha Pharmacy, and Just Right, where you could buy Platos monitor with integrated body composition monitor, which is important for managing weight and obesity, which is a risk factor for diabetes. So not only for people living with diabetes, but people that are actually working on prevention. You can go to any of those stores this week in specific addresses. Sorry, I don't remember those addresses offhand at the moment. And you can get a discount code to buy your device. You can also actually just check your body score, which is a new invention, a new feature that we're kind of rolling out. And so you'll be one of the first people to test that feature out and get an idea of what your body looks like. So that's something that I wanted to leave you with. And on through Platos, you can also monitor most of those primary markers that we spoke about: the blood pressure, cholesterol, your glucose level, your waist, and obviously we give about 20 data points on body composition. And then we kind of make sure that those insights, we can summarize them for you. You understand what they mean. And with some of our other products, which we connect to hospitals and clinics, you can actually you can give access to your doctors to that data so that they can make timely decisions about your treatment plans. If some of you that are, especially for some of our customers that are, that are already living with chronic conditions, not so much on the preventive side. Yeah, that's it so far. Thank you very much for coming, everybody. And like I said, we're going to send you a follow-up email with some of these things that I mentioned today. And I wish you a super nice evening. Bye.
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 Bye.